Hello, social media. I'm back again, nurse practitioner Katina Kennedy, back with a health tip for you for the week. For those who are just joining me, I have a lot of videos that I post periodically regarding certain topics regarding to your health. You can check me out on YouTube, also Social Cam, and then of course on Facebook. So feel free to go through my archives and take a look at some of the old videos that I've shared, because I would love for you to be informed about different topics that I have talked about. I've talked about diabetes, I've talked about women health topics, I've talked about allergies and so forth. So make sure you check it out. So today, what's on my mind? What's on my mind is, let's talk about GERD, G-E-R-D, which is gastroesophageal reflux disease, okay? And what that is another name for that is heartburn. We know it, or acid production. The reason why I'm talking about this, because this is a very common disorder that many people have. For example, do you wake up bloated all the time? Or are you just constantly bloated all the time? Or nauseated? You wonder why after you eat, you kind of get nauseated, or you only eat a little bit of food. Or so gassy, bloated, nausea. Also increased gas. If you have, and then of course your heartburn. And you don't have to have heartburn to have GERD. A lot of people don't have those particular symptoms as far as the actual heartburn. They may just have just the nausea, the bloating, and just the feeling of being full early despite only eating a little bit of food. I'm going to adjust the camera here. Okay, there we go. So a lot of people may not have those symptoms. Also, a cough, a dry cough is another symptom. A chronic dry cough is another symptom of increased acid production. So those are some symptoms of GERD that you may be experiencing. So if you're always bloated, nauseated, feeling full fast, you may have some sharp pain, increased gas as well. You may have what they call the increased acid production, or GERD, or if you experience some heartburn as well. So those are some symptoms. Why should you treat it? This needs to be managed, because when you have an increased acid production, that can actually damage the lining of the stomach. Just imagine acid, just tearing away at the lining of the stomach. That's acid. That's acid that comes up. Take your tongue and feel the inside of your cheek. Go ahead and take your tongue and feel the inside of your cheek. That's the inside of your lining. So just imagine acid tearing away at the inside at that soft, tissue that you feel there. So if you have that increased acid, eventually it can cause ulcers. And then ultimately, if it's not treated, it can definitely cause GI bleeding, which is stomach bleeding or intestinal bleeding. And then it can also cause Barrett's esophagitis, which is just inflammation of the esophagus, or it can cause eventually cancer. So it's so important to treat this heartburn, or to treat this mild gastritis, which is inflammation of the intestinal area that may be caused by increased acid production. So what do you do to prevent this? Well, it's important not to skip your meals. All right. If many of you all notice, you may experience this sometime if you don't eat on a regular. If you skip your meals, you definitely can experience this. So don't skip your meals. Stand away from spicy foods, greasy foods, caffeine, certain alcohols, and it may not be all of it for you in particular. And that's where you'll have to write down like a food journal, just to keep track on the foods that you eat and when you experience that pain, so that you'll be able to identify what may be causing that increased acid production for you. So again, just examine your food. So with certain foods, lack of eating. The reason why lack of eating can cause this increased acid production is because what happens is your stomach normally produces acid. That's the stomach pump. It usually produces acid, and that's what it does to break down the food. The acid breaks down the food. So when you don't eat, guess what? It's still producing that acid. Okay? But when it's producing that acid, because you don't have any food in your stomach, it's, breaking down the lining of your stomach. So it's so important that you eat on a regular, because if not, it's going to tear away at that lining of the stomach and cause those complications that I mentioned earlier in the video. So again, I'm not going to keep you long. This is just a health tip. You can inbox me if you have any questions, contact me, or see your healthcare provider, because it's so important that, you get this treated. So again, if you experience constant bloating, nausea, especially after eating, abdominal cramping, abdominal pain, abdominal tenderness, some heartburn, gassiness, burping all the time, those are some signs and symptoms or a chronic cough, and those are some signs and symptoms that you need to get checked out, and you have to treat it. Most people, sometimes if it's related to certain foods that they've eaten, like if you've had let's just say you ate some spicy foods, greasy foods, and you've noticed, or alcohol, and you notice that the symptoms increased after eating that, then sometimes just taking like a Prilosec over the counter can help. Taking a Prilosec or Prevacid over the counter for about 10 days. So taking that for about 10 days, one every morning, that will help just settle the stomach a little bit. So after the 10 days, if the signs and symptoms still continue, then I would definitely recommend you see your healthcare provider, because it could be something a little bit more serious. So if you experience these symptoms, go ahead, try the Prilosec, Prilosec and Prevacid, either one. I personally think a lot of my patients, they respond better to the Prevacid. So, but of course, it'll say for heartburn. But again, if you're having any of those symptoms I mentioned, try taking that for about 10 days. And of course, watching the foods you eat and see if that resolves your symptoms. If it does, good thing. If it does not, again, you need to see your healthcare provider. So today I talked about GERD, gastroesophageal reflux disease, mild gastritis, which is inflammation of the intestinal area. I talked about some signs and symptoms. I talked about ways to help prevent it, and so forth. So if you need me, I'm here. And again, nice speaking with you. I'll see you next time, social media. Take care.